And last but certainly not least, maybe the most important perspective of all, we have Felicia Willems, who is a mother and an advocate for children.
Good afternoon. I want to thank Action for Children and all of the co-sponsors for putting on such a wonderful event and for inviting me to come and tell you my story today. My name is Felicia Willems, and I'm here today as a mother, an advocate for children, and a proud member of momsrising.org. 3 years ago, my husband and I were very excited parents-to-be, and when my son Ethan was born, we received the shock of a lifetime. We found out that our new baby boy had a vascular tumor that covered most of his lower right leg, and he would require chemotherapy. He started oral steroids at 6 weeks old, and on my second day back to work after maternity leave, we found out that his health had spiraled out of control so quickly that he needed to start chemotherapy immediately. He had to have surgery to put an external port into an artery near his heart to administer the chemotherapy because he was so small, and he was on codeine because the pain of his tumor was unbearable. Needless to say, he needed round-the-clock care, and I had to quit my job to care for him. To make matters worse, he started his first round of chemotherapy on my husband's first day back to law school at UNC. We had just bought our first home, we had some financial stability, and felt like we were prepared for starting a family. Our plan was for me to continue to work after Ethan was born, and as the primary breadwinner, quitting my job meant losing our family's only source of income, and more importantly, our health insurance. Fortunately, Ethan qualified for Medicaid due to our newly found financial situation, and without this government-run health insurance program, he most likely would have lost his leg and possibly his life. Finding insurance for me was no easy task because I have a chronic kidney disease, and as you can imagine, insurance companies were not exactly looking to provide us with low-cost health insurance. We were now faced with caring for a sick child, no income, and having to pay expensive insurance premiums to maintain minimal health care coverage for my husband and me. Ethan's tumor began to heal around the time he turned 1, but that was followed by him needing over a year of intensive physical therapy, speech therapy, and occupational therapy just to get him back to normal. We managed to get my husband through the rest of law school by taking student loans, draining the savings he had left from his GI Bill, and getting help from family, but in the end, we still ended up needing to sell our home and move in with family just to keep our heads above water. Now that my little guy is healthy, now that my husband is an attorney, now that we've made it through 3 years of strict budgeting and sacrificing, we are still suffering the financial drain of private health insurance. Even though my husband has finished school and passed the bar, he has not been able to find a job that offers health insurance because of the way the job market is now. I too have returned to work, but have only been able to find part-time contract positions that don't offer benefits, of course. I realize how fortunate we are to have the support of our extended family. Most Americans are not as fortunate. Either by design or circumstance, many of them don't have family members who can financially afford to help them. What happened to us could happen to anyone. It is happening right now to people all across America. They're losing jobs and finding out health coverage is denied by their insurance companies. The bottom line is, because there was a public health insurance option available to our son, he is still alive today. And if there had been an affordable health insurance option available for my husband and me, we might still have our home. Access to basic health insurance should be available to everyone, regardless of age, income, or employment status. We no longer can wait as a country to help each other during catastrophes and hard times. No one should have to choose between paying their mortgage and paying their insurance premiums. No one should have to choose between keeping their home or caring for a loved one who is ill. No parent should have to choose between caring for their child or losing their home. We are better than this. America is better than this. It is time for us to start loving our neighbors as we do ourselves, and realize that a country with healthy citizens will in turn become a healthy nation.